At the time that you scheduled surgery, you were either through email or regular mail received a what to expect brochure. That document is really beneficial even after surgery because it does give a lot of information about what to expect once you return home from having your tubal reversal. Most of our patients do return to work in 3 to 5 days and are back to the majority of their normal activities within a week to 10 days. We prefer that patients avoid heavy lifting, objects more than 15 pounds, avoid sit-ups and crunches for 4 weeks. But for the most part, you can resume activities as you're comfortable. The tubes are put back together well, the muscle and the fascia have been sutured back together. So really, there's not anything that you could do to injure the tube, but we do like for you to avoid anything that puts undue stress on the muscle for about 4 weeks. One of the most frequent questions that we hear following surgery, and typically we receive this question 2 to 4 weeks following the procedure, is that the patient's experiencing a burning or pulling sensation on one side of the incision or the other. And this can be related to a lot of things. It really is, in most cases, not anything to be concerned about. It's something we typically hear, and it's probably related to a combination of things: nerve irritation, compression, and pulling on the tissues during surgery. But it can be relieved in many cases by taking the ibuprofen, or a patient can use an ice pack intermittently. By that I mean an ice pack on for approximately 15 minutes and then off for 45, on for 15 minutes and off for 45, and that should help to cut back on some of that. Because there is an increased risk for a tubal pregnancy following the tubal reversal procedure, and because we do think it's important for patients to follow the early pregnancy monitoring protocol, we suggest that you have the conversation with your local physician before you ever can begin trying to conceive. So as soon as you return home following surgery, you have that conversation with your local doctor so that you know at that time whether he or she is going to be willing to assist you with drawing your blood twice weekly and performing the vaginal ultrasound when your HCG levels reach the most important thing 1500 to 1600. That we want to talk to all patients about is the long-term risk of an ectopic pregnancy following surgery. For that reason, as soon as you miss a period, we want you to take a home pregnancy test. If that's positive, you'll need to have your serum HCG levels, that's the pregnancy hormone, checked twice weekly until the levels reach 1500 to 1600. In some cases it may need to get to 2000, but at that point you should be able to, the gestation sac should be seen on a vaginal ultrasound exam. We want you to inform our office when you have a positive pregnancy test, and we'll also ask you to fill out the pregnancy report form on our website.